Once you find out you're pregnant, you could start making week-by-week plans for the pregnancy. You might ask extra questions about a healthy pregnancy every day. What food is best for you? Can you work out? What kind of prenatal exams should you take into account? Pregnancy's first 3 months can be very demanding. Recognize the changes you might go through and how to take care of yourself during this wonderful moment. The first trimester is a time of rapid change for both you and your unborn child. You may experience breast soreness, tiredness, and nausea, along with a mix of emotions from excitement to anxiety. Your baby's heart begins to beat, and the brain, spinal cord, and other organs start to form. Even tiny fingers and toes begin to develop. Understanding the physical and emotional changes of the first trimester helps you approach the coming months with confidence. Set up an appointment with your doctor or nurse to start prenatal care. With the right knowledge, you can take the best care of yourself and your baby throughout this special time. Pregnancy's second trimester is frequently the most enjoyable. You'll discover strategies to treat typical symptoms and, it's a good time to think about how to get ready for the future. You may experience improved health than you did at the beginning of your pregnancy during the second trimester, which lasts from months 4 to 6. Enjoy this stage of your pregnancy. Your baby might start to seem more real during the second trimester. A growing belly, bigger breasts, and skin changes are all possible signs and symptoms of a second trimester pregnancy. The second trimester is frequently when your unborn child begins to hear and move. You will be halfway through your pregnancy by week 20. This trimester is frequently accompanied with an increased feeling of well-being. Most of the time, the worst of the nausea has subsided, and the baby isn't big enough to cause you significant discomfort. There are still more pregnancy signs to come. Here is a general overview of what to expect. You could go through a number of physical changes throughout the second trimester of pregnancy, which include expanding breasts and tummy. Your belly increases as your uterus enlarges to accommodate the growing baby. Additionally, the size of your breasts will continue to grow over time. At this point, you should wear a sports bra or a supportive bra with wide straps. Braxton Hicks contractions. You may experience a tiny pressure in your abdomen during these brief, erratic contractions. After physical exertion or after having sex, they tend to happen more in the afternoon or evening. If the contractions begin to occur frequently and steadily get stronger, contact your doctor. It could be a possible indication of preterm labor. The skin changes. Your skin's melanin production rises as a result of hormonal changes that occur during pregnancy. As a result, your face may develop brown patches, also called melasma. Additionally, a black line may be visible on your abdomen, known as linea nigra. These skin changes are frequent and typically disappear after delivery. Sunlight exposure, though, can make things worse. Apply sunscreen when you're outside. Also, you might detect reddish-brown, black, silver, or purple lines on your thighs, buttocks, abdomen, or breasts, which are stretch marks. Stretch marks cannot be avoided, however, the majority of them ultimately reduce. Nasal difficulties. Your hormone levels rise and your body produces more blood while you are pregnant. Your mucous membranes may enlarge and bleed more readily as a result, resulting in stuffiness and runny nose. Congestion can be relieved with saline drops or a saline rinse. Additionally, to help keep skin moist, drink a lot of water, use a humidifier, and apply petroleum jelly on the corners of your nostrils. Tooth problems. Your gums may become more sensitive to bleeding when you brush and floss because of pregnancy. Inflammation can be reduced by using a softer toothbrush and rinsing with salt water. The enamel of your teeth may be weakened by frequent vomiting, increasing your risk of developing cavities. During pregnancy, make sure to maintain good dental hygiene. Dizziness. You may feel lightheaded due to changes in circulation brought on by pregnancy. Drink plenty of water, avoid standing for prolonged periods of time, and move slowly whenever you stand up or change positions if you experience dizziness. Lie on your side if you start to feel dizzy. Leg pain. Leg pain, which frequently occurs at night as the pregnancy advances, is common. Stretch your calves before bed, keep up your exercise, and consume lots of fluids to ward them off. When choosing shoes, keep functionality, support, and comfort in mind. Stretch the affected side's calf muscle if you have leg cramps. Also helpful can be a warm bath, a hot shower, or an ice massage. Vaginal discharge. A white, transparent, or sticky vaginal discharge may be noticed. That is typical. If the discharge starts to smell strongly, changes color, or is accompanied by pain, soreness, or itching in the vaginal area, speak with your doctor or nurse immediately. This can be a sign of a vaginal infection. Infections of the urinary tracts. Pregnancy increases the likelihood of certain infections. If you have a fever or backache, a strong urge to urinate that won't go away, a sharp pain when urinating, urine that is cloudy or smells strongly, or if you have these symptoms in addition to a cloudy or painful urination, you should get in touch with your doctor. UTIs, or urinary tract infections, can develop into serious kidney infections if they are not addressed. In conclusion, you might feel less exhausted and more capable of handling the stress of getting ready for your kid throughout the second trimester. Look for a doctor for your infant. Study breastfeeding. If you plan to continue working following the birth of the kid, familiarize yourself with your employer's maternity leave policies and look into options for childcare. You might be concerned about childbirth, labor, or approaching motherhood. Learn all you can to reduce your anxiety. Put your efforts into choosing a healthy lifestyle that will give your child the greatest start possible. Also, during the second trimester of pregnancy, your prenatal sessions will be centered on monitoring the development of your unborn child and looking for any health issues. Your doctor will start by taking your blood pressure and measuring your weight. Your doctor may check your fundal height, which is the distance between your pubic bone and the top of your uterus, to determine the size of your uterus, or fundus. The best part of your prenatal appointments right now might be hearing your baby's heartbeat. This trimester, your doctor might advise an ultrasound or other screening tests. If you so want, you may also discover the sex of your child. Pregnancy's third trimester can be, well, pretty taxing and even painful at times. Backaches, heartburn, and a growing sense of anxiousness are just a few examples of third trimester indications and symptoms. Your baby is expected to open his or her eyes and gain weight during the third trimester. The fetal movements might become more obvious as a result of this rapid growth. It might be challenging for you to relax due to your baby's size and position. It's possible that you want to move on to the next phase because honestly, you're just sick of being pregnant. And you might even feel disappointed if your due date arrives and passes without any complications, especially if you've been preparing for it. While you're anticipating the end of your pregnancy, try to keep a positive attitude. Your newborn will be in your arms soon. What to expect in the meantime is listed below. As your pregnancy progresses, you'll start to feel your baby move more and more. Along with these thrilling feelings, the following signs and symptoms are typically present. Breathing difficulty. You might become easily dizzy. Try to maintain a straight posture to offer your lungs more room to expand. Heartburn. The valve between your stomach and esophagus is relaxed by pregnancy hormones. Heartburn may result from this, allowing stomach acid to leak into your esophagus. Eat little, frequent meals to stop heartburn. Also, avoid hot or fried foods, chocolate, citrus fruits, and fried or greasy foods. Regular urination. You'll feel additional pressure on your bladder when your baby pushes itself further into your pelvis. It's possible that you'll urinate more frequently. When you laugh, cough, sneeze, bend over, or move something heavy, this added pressure may also cause you to leak urine. If this is a concern, think about using panty liners, and definitely contact your healthcare practitioner if you suspect amniotic fluid leakage. Backaches. The connective tissue holding your bones together is relaxed by pregnancy hormones, particularly in the pelvic region. The third trimester of pregnancy is a difficult time for your back because of these changes, which frequently cause discomfort. Choose chairs with supportive backs while you sit. Exercise on a regular basis. Go for low-heeled footwear with supportive arches. And as always, contact a healthcare practitioner if you are experiencing severe or ongoing pain. Varicose veins, hemorrhoids, and spider veins. Spider veins, which are tiny reddish-purple veins, may develop on your face, neck, and arms as a result of improved blood circulation. Usually, after birth, redness fades away. On your legs, you could also detect varicose veins, which are swollen veins. Hemorrhoids, which are painful, itchy varicose veins in the area of your lower abdomen, can also happen. Exercise, regularly elevating your legs, eating a diet rich in fiber, and drinking a lot of fluids can all help reduce swelling. Warm baths or witch hazel pads can provide relief for hemorrhoids. Braxton Hicks contractions. You may experience a tiny pressure in your abdomen during these brief, erratic contractions. After physical exertion or after having sex, they tend to happen more in the afternoon or evening. If the contractions begin to occur frequently and steadily get stronger, contact your doctor. It could be a possible indication of preterm labor. Fears associated with childbirth could intensify as anticipation builds. What will the pain be like? How long is it going to last? How will I handle it? Think about enrolling in childbirth classes if you haven't already. You'll discover what to anticipate and meet people who share your enthusiasm and worries. You may be wondering how many weeks make 3 months of pregnancy and so on. Or you may be tired of doing the calculation all by yourself. Let's break everything down for you. 1 to 4 weeks equals 1 month, 5 to 8 weeks equals 2 months, 9 to 13 weeks equals 3 months, 14 to 17 weeks equals 4 months, 18 to 21 weeks equals 5 months, 22 to 26 weeks equals 6 months, 27 to 30 weeks equals 7 months, 31 to 35 weeks equals 8 months, 36 to 40 weeks equals 9 months.